Hi, everybody. Welcome to Eye Care Specialists. This is our cataract webinar. In our attempt to social distance, as we're supposed to, we decided to hold a webinar. We do want to assure you that we're doing everything that we can to, and following all CDC guidelines to make sure your visits to our office are safe and comfortable. As a special thank you for all attending tonight, we will be doing a raffle and giving away a free pair of sunglasses valued at $200. They can be picked up at any one of our 8 optical shops, and we'll let you know who the lucky winner is. If you would like a counselor to call you to schedule an individual consultation, you can just type your name and your telephone number in the chat bar at any time, and we will get back to you. So here's how to ask a question if you're not familiar with the chat bar. At the end, we're going to be answering questions from the audience. So please type your question in this chat bar. If the control panel is not fully displayed, you can click the orange arrow. Type your question in the chat or question box and click enter or send. And you may ask as many questions as you would like. Eye Care Specialist is comprised of a large group of highly trained optometrists and ophthalmologists. They are committed to excellence in patient care and are leaders in the medical surgical eye care field. We have 8 locations throughout northeastern Pennsylvania and our own fully accredited surgery center. We'd now like to introduce you to our 5 cataract surgeons. We're going to be meeting Dr. Reiser and Dr. Roth live tonight. But we also have Dr. Donald Savage, who does cataract surgery, and we have Dr. Daniel Letts and Dr. Robert Zagorski, both of whom are also glaucoma specialists. And they can also remove your cataracts for you. Dr. Roth will be one of our presenters tonight. Dr. Roth is actually a dual board certified surgeon. Not only does he do cataract surgery, but he does laser cataract surgery. He does all the advanced lifestyle lens implants that we're going to talk about tonight, but he's also dual certified in oculoplasty surgery. So he can do cosmetic surgery, eyelids, facial surgery, and aesthetic procedures. So he's the guy you want to get to know pretty well. We also have Dr. Harvey Reiser presenting tonight. We could switch slides. There he is. Dr. Reiser does cataract surgery. He also does laser surgery, LASIK surgery. He has been instrumental in getting lenses approved for usage and has been a pioneer in the field of the upgraded lenses. He also treats diabetic eye disease and does retinal lasers when needed. And now, without any further ado, I'll turn it over to Dr. Reiser and Dr. Roth.
Okay. Dr. Reiser, Dr. Roth, how are you? All right, so let's get started here. Tonight, we're going to talk about modern day cataract surgery. We'd start off, we have some basic things to talk about what a cataract is. We'll talk a little bit about surgery. And probably the most exciting thing is about the options you have in current modern day cataract surgery. So I think at this time we'll start. Kind of people all the time ask, what is a cataract? They'll come in, and as you can kind of see what happened right here in this, on screen here, you had the headlight of a car when it's brand new, it was crystal clear, and now it has become yellow. And that's basically what happens to the natural lens that's found in our eye. And at some point, when that color change of the lens gets to a point, it starts to cause us visual problems. Sometimes your vision is just not as clear, or you have glare or halo at night. And that's really what a cataract it is, and that is the most common thing that we experience. So why don't we go ahead and advance the the frames here. So again, here you can see what a cataract is. On the upper left here, you can see where there is no cataract right here where my pointer is. It comes back. You can see that we have a nice sharp E, the letter E, typically what you see when you're in the exam. So if you come over to the next picture, what you'll notice, it's blurred at this point. And what basically has happened is that lens in front of the eye has become yellow, like we just showed you in that picture, and it causes your vision to be blurred or scattered. So why don't we go ahead and proceed on?
So a cataract causes blurry vision, faded colors. You may not notice the colors being faded. It happens over many years. But when you have your cataract removed and replaced, you'll notice the brightness of things. All of a sudden, it's like the whole world got painted with white and blue colors because it just gets very vibrant. Sometimes people come in and say, I have double vision or ghosting of images in addition to nighttime disturbance. So it can present itself in many different ways, but generally it's affecting your vision and you're not, in this case, not seeing the level you'd like to see and would like it improved. Thank you. Keep going. So on the right, we're seeing someone who has no cataract. Headlights, while bothersome, are of a normal size. On the left, we see the glare, the diffusing of light, making it more and more difficult to drive and stay in the lane. That's real typical. Rich Roth and I, we see a lot of people that complain about driving at night. That's a very, very typical early sign.
All right, so why do cataracts develop? And really, probably you can see we have in the boldest letters here is it's an aging process. So the lens we're born with at the beginning of our life stays with us throughout our life, and of course it just changes. And that by far is the most common thing that causes cataracts. The other things we can see, genetics, exposure to sunlight, medications, injury, disease, smoking, they're all very small. Definitely as we move along in life, aging is the main process that causes our cataracts.
If you look at people that are over about 75 or even say 70, you generally track, and if someone's 70 years old, they have about a 70% chance of having a visually significant cataract. So we see cataracts in kids and young adults, and more so a cataract in its early phases, we deal with it earlier on, but it really is just primarily aging. I think the rest of the things on here seem to be pretty minor.
Right, and I think also what you need to be aware with, we are, cataracts do affect us in our 40s and our 50s and 60s. So, a lot of times someone will say, well, I've told I had a cataract and their vision is gone, they've got new glasses. So years ago, we waited till cataracts were very advanced. Now, really, the time that when we think about cataract surgery is when we're starting to have symptoms of that glare, we're having difficulty with our vision. So even though we think of it as a process of, senior years, there are times, even in our 40s and 50s, where we need to address these.
Yeah.
Go ahead, you want to take it?
Sure. So when I first started about 30 years ago at Wills, we used to make real big incisions. So you'd really want the cataract to be very ripe. And the word ripe or mature was important. And that's because we kind of squirted the cataract. This is going to sound a little funny, but like the pea out of a pod. So you make an incision in the eye and tease the cataract out, again, like a pea in the pod. And we had to close it with multiple stitches, and the recovery was long, was not insignificantly uncomfortable. And sometimes if we couldn't put an implant in, and if you remember back, at least I remember back when I was a kid, so you're talking 50 years ago, people would wear these real thick glasses. So that's old, that's not happening, but understandably you would be more fearful. We can jump ahead.
So, when we've just talked about cataract, and here are some facts that I think are very enlightening. So if you think 20 million Americans are over 40 years of age have cataracts, as we just discussed. It is the most performed surgery in the United States and probably worldwide. 50% develop cataracts by age 65 but the real important line here to take away is, is just as Harvey was saying, where cataract surgery used to be a very scary thing, it now has over a 99% success rate. So, for a procedure that's being performed so much, it affects most people in America and around the world, it has a very high success rate, which should be very assuring.
Now's an exciting time
Here
to
we
have
go.
cataract surgery. Here we go. Let's talk about the good stuff, okay? So you have options. This is the one time in your life that you get to think about how you want your vision for the rest of your life. So you get to reset what you have. If you've been wearing glasses your whole life because you're nearsighted, we can change that. So there's now available laser-assisted cataract surgery instead of bladed surgery. We can now treat astigmatism, or we're going to talk about what that is, and we can really cut back your need for glasses. And you get to decide what you want. Do you want to wear glasses at all? Do you want to wear them just for reading? We can help you achieve what you'd like.
Here we go. So one of the big things that we talk about in cataract surgery today that's exciting that we can treat is astigmatism. So, you know, cataract surgery in the past, we removed the cataract, we put in nice new lens in the eye, but we weren't able to treat astigmatism. So you had a new lens in your eye, but your vision was still blurry in many cases. And why is that? So astigmatism is kind of a structure of the eye. See there, we have what's called a basketball or a football. So really your eye can either have a shape as a round basketball, and if you look at the image below that, what you should think about is just like when you bounce a basketball, it can come straight back up because the curvature on that ball is the same everywhere. So light that hits that round eye like that all focuses at one point. So if you see on that slide, the little red dot at the back of the eye, all the light coming into the eye is able to be focused into one place. Most people have some degree of astigmatism. That's on the right. So what does astigmatism mean? You have more of an oval shape, or what we would say a football shape. So what does that mean? When light hits a football or an oval shape, it's going to have two curvatures. You have the soft side and you have the very round side. So it causes 2 points of light to be focused into the back of the eye, as you see by those two red dots. So neither of those dots are focused together on the back of the eye. So even though we've removed the cataract and you had a new lens implant, your vision afterwards was still blurry in some cases. So now that we can treat astigmatism at the time of cataract surgery, we're able to address not only the cataract, but also the refractive outcome of your vision, making it sharper. Doesn't mean that you can't wear glasses, you can't use glasses, but the overall quality of the vision by treating it at the level of the eye or inside the eye is going to be much better for astigmatism management than using glasses on the front of your face. Think about if they're tilted or they're too far down, you're not getting the proper focus. So why don't we go ahead and move on to the next slide. And this is a picture, kind of what we were just talking about. So on the left, you see that the colors are kind of washed out, nothing sharp. And then you go to the middle picture. Well, that's someone who had cataract surgery, but the astigmatism of the eye was not addressed. So while the colors are more vibrant, more light comes in, things are still blurry, okay? So yes, you could wear glasses or something like that to treat that. But on the right, now this is an eye that not only had cataract surgery, but also had their astigmatism corrected at the time of surgery. And what you can see is now you have the bright lights, you have the crisp colors, but also the detail, the picture is much better because your overall quality of vision, you know, high definition, what we're all buying TVs these days, is in front of you.
So basic surgery, I tell people there are three choices in regards to cataract surgery nowadays. This is the first choice, what we're going to call basic surgery. This is older technology, like 1985 technology. It is good surgery, but it's not as good as we can do. So it's outdated. That's all there is to it. It's like all technology around us. If you're buying a brand new car, would you buy a brand new 1985 car? Maybe you would, but if you buy the 2020 car, you're more likely to have side airbags, protection against impact, collision, etc. So basic surgery is bladed surgery, a routine lens implant, not customized to the eyes. We are not fixing astigmatism, and you may well need glasses for all tasks, distance, intermediate, and near. As an example, a basic outcome here, This is meant to show you a blurry background. This is without glasses, a blurry background for the distance and a blurry background for the phone, because things like astigmatism are not corrected in this case.
And we can proceed on. So then you have, as Dr. Reiser was saying, you have 3 levels of cataract surgery: basic, and then we really get into advanced custom cataract surgery for your eye. And what's the advantages here is that we're using the latest technology. In this case, we may use laser-assisted cataract surgery or no blade to make very critical incisions during the cataract surgery. We have advanced lens implants, some of these for astigmatic correction, and we'll talk in the future about also giving you a fuller range of vision, where really we're trying to give you not only your distance vision, but looking at your computer and looking at your phone and really having some freedom there. Additionally, in this case, we correct the astigmatism because we know how much better that makes the vision. So really, when we do advanced custom, our second level, when we're doing this advanced cataract surgery and we're customizing it, we're really maximizing the vision for the distance or near, so that you're not using glasses for one or the other. Sure, most people, and there was a large study actually done, and it was done through Google, most people really prefer to have great distance vision and wanted to use more reading glasses for up close. And here's a perfect image of that. So what you can see here in the distance, you have very sharp, you can see your lake, you can see the beautiful forest across and the sun and the sky. But still, when you go to hold up that device in front of your eye, or if you need to look at your watch or your compass, if you're lost with your kayak there, you might have a hard time seeing it. And I think that's really, one of the things that's really important for you to think about is, as we move forward, and we're going to get into this now, device management. As our life moves more and more to using cell phones, special digital watches, looking at computers, looking at our iPads in our homes, really that intermediate and near vision is becoming much more prevalent in our life, less than probably looking at newspapers. But why don't we go to the next slide? And here is one where we customize the surgery, this time for up close, so everything's close, but in the distant, things are blurry. So again, you have great customized vision, either near or in the distance, but you don't have both, so you still need a little reading aid for one or the other.
So that's the first step up in advanced cataract surgery, where you're maximizing either distance or near and wearing glasses for the other one. Okay. Visual freedom is, again, like we just mentioned, laser-assisted cataract surgery is available, advanced lens implants, astigmatism correction, and now we're trying to minimize all glasses, giving you back distance and near. So that's why we call it visual freedom. The reason why this exists is because people, when they would see well in the distance, they'd often say to us, wow, I'm great far away. And what they mean is really 4 or 5 feet and out is pretty good. But every time they come inside that area, they always have to grab their readers. So it's inconvenient. That's why this package exists, to try and give you back distance and near, to try and minimize glasses. It doesn't always eliminate them, but the goal is to eliminate them. And with today's technology, we really can get very far along. Go ahead. And this slide is trying to show that. So we have good distance and we have good near, and that's the best. That's what I think most of us would rather turn the clock back to before 40 years of age and see well in each location. Go ahead.
So when you take a look at the results, and we again talk about these 3 different levels of surgery, we have basic cataract surgery, again, using past, older technology during that time. And you'll probably need glasses for most tasks that you perform. Then we have our intermediate, or what we call advanced custom surgery. We're really focusing on either great distance vision or up close. And then we have the highest level, where we're really looking for visual freedom, reduce the need for glasses, and really give ourselves a quality of life that most of us haven't. If you think about it, if you started to use glasses when you were young, that's one thing. Most people start using them in their late 30s or 40s for others. So really, it's all of a sudden, it's, you know, when you talk about rejuvenated things, this type of package really is rejuvenating, kind of giving us vision that we either wish we had had earlier or gives us the opportunity first in life to have it.
And this is kind of like LASIK for younger kids, that is people under 40, where they're trying to maximize their quality of vision. Basic surgery, I really don't recommend. When I talk to people, I generally don't recommend that. And the reason why I don't is not because for anything other than the fact that the technology is just better today. However, it's the least expensive, and in that regard, it's the best for that particular need. We'll get into that a little bit more. Let's go ahead and jump ahead now. So your procedure, it's changed. I mean, it's an outpatient procedure done in a surgery center rather than a hospital. You're awake and comfortable and relaxed. So we give you some mild sedation to take the edge off. Everyone's nervous, that's normal. The idea of having your eye operated may be somewhat scary, but the actual experience is not bad. It's generally a 10 or 15 minute procedure. We do it under eye drop anesthesia, no needles to make you numb. We don't use stitches typically at all or sutures. You don't have to change your clothes, so you dress in something comfortable. And you're back to most activities as soon as the next day. So it takes a couple days to get the vision back to a large degree, but you're able to do most things except for rubbing your eye or getting it soaking wet or lifting real heavy things almost right away. Go ahead.
Okay, here we go. Going dropless. So one of the great things I think Dr. Reiser and myself have instituted here at our eye center is that we do what we call dropless cataract surgery. So you might have had friends, or you personally might have had surgery yourself on one eye, and you know, in the past we would start having you use a drop the week before surgery or a couple days, and then you would be on eye drops for about 4 weeks afterwards. And you know, a couple of the problems with eye drops are, first of all, we would prescribe one type. You would go to your pharmacy, they may not have that, or it may not be covered by your insurance, so it could be expensive. Two was people would lose their drops, or quite frankly, they had cataract surgery and their eye was feeling pretty good, so they weren't using their drops as often as they should, so they would get a little irritation or sometimes, you know, inflammation on the eye. So we actually followed two large studies that were done, one in Europe and one here in the United States, and they had thousands of patients in it, and actually showed that if we applied the medicine inside the eye and around the eye at the time of surgery, that patients did as well, if not better, by having that treatment. So we have moved our practices forward, just like the technology of cataract surgery, but in our care, and we do what's called dropless cataract surgery. So at the time of surgery, we'll actually place some of the medicine inside the eye, but we'll also place some of the medicine under the skin of the eye so that you afterwards, in most cases, you do not need to use drops. So it's a significant cost savings to the patient. As it says here, it reduces the risk of infection, and it's incredibly convenient and simplicity for you.
A really big change forward. So all the hassles of getting drops, getting someone to help you put it in, missing your eye, getting frustrated, forgetting the drops, that all goes away. This is, and again, that reduced risk of infection is by a factor of 10 times. So it's really a nice step forward for the patients and for us too.
Good.
Laser assisted cataract surgery. So things have moved on. When I started again all those years ago, surgery was excellent then. It just continues to get better and better. And it's always in an attempt to continue to get the vision the best it possibly can be. So laser assisted allows us to do a number of steps that usually was done by hand. The laser can make us more precise and accurate and gentle. I think it's a terrific procedure, and one that if I was having my eyes done, I would have a laser done for me. I think we were the first in the area to do it, and I'm not sure there are many others that are doing it. We've been doing this now for about 7 or 8 years, and I think it's the way to go.
And I can personally testify to the fact that I did develop cataracts at a younger age, and when I chose to have my cataract surgery done, I did have laser assisted cataract surgery for both eyes for the reasons that Dr. Reiser mentioned. You know, very precise incision, very gentle, you know, less energy being used in the eye, And, you know, I thought if I was having it, there's no other way I would do it.
And that's part of the packages that you are getting involved in. Affordability. So all the insurances that we deal with will pay toward cataract surgery for all 3 levels. Basic cataract surgery does not have any costs beyond the basic cataract cost itself. The upgraded the upgraded packages for distance only, near only, or distance and near does have an added out-of-pocket expense. And this is the time to consider it and consider what the value of your vision is. For example, how often do you use your eyes? Every day, all the time when you're waking and looking. And also just to consider what's the cost of glasses or contacts. So if we can reduce that, it offsets much of what we're going to have to charge that it costs us to do these advanced procedures. And we do offer some care credit interest payments that have 0% interest, and I believe it's up to 24 months.
Yep. Mm-hmm. And this is just a great slide, I think, that helps you really take a value of, you know, your vision. So, you know, if you take a look on the left, we have smartphones, we have cable TV, cars, and then we have cataract surgery. And you can say, okay, well, you know, the average phone, so you pay, and these were done locally. We took prices locally, about $145 a month for a phone. TV bills, $123. Car payments, $541. And then if you have cataract surgery, you know, and you did finance it over 2 years, your payment is around, you know, $100 to $125, as you can see. But I think really the next line is really important, the time spent. You know, if you take a look at the 3 above that, it's less than 25% of your day. What do you use more than your vision? 100% of the time we're using our vision, except for sleeping. And, you know, you take a look at 2 years, what you've spent for a cell phone is around, you know, $3,000. For cable TVs, $3,000. For cars, $12,000. But for your vision, you know, you've only spent $2,000 to $3,000. And that is really important. If you think about that, the value of 100% of the time you use and the return on that is tremendous. And then you take a look at 5 years after that, you're still paying for those other things. But if you take a look at your vision at the bottom, you know, you're done paying for it and you get to keep it. If you stop paying for your car, you stop paying your TV bill, or you stop paying your cell phone, they get turned off. You keep your vision, you use it every day. So, you know, I know for some people it's very disheartening that there is additional costs, but, you know, I really think you have to look at it in modern times and how we have other bills and how important your vision is.
Yep. Just a brief touch. If you come to see us, we're real careful to be sure that we're following all we can to protect you and us. So that includes screening before you come to see us to make sure you haven't had an exposure to COVID or something along those lines. Everyone, yourself and us, we all must wear masks. We are cleaning everything after a patient touches it. So if you're sitting in a chair out in the waiting room, that gets cleaned afterward. You come into our office. The office that you're in is dedicated to you until you're done. And we have a protective shield between yourself and us when we're examining you in that slit lamp. So it's a plexiglass shield that protects you. So I think we're doing all we can and going above board to make sure that you and our staff are safe in this unusual time with COVID. So reclaim your vision. This is the only chance you're going to get. This is not like changing your pants or your shirt because you don't like it the next day. We do this once. So it's the time to think about it and ask the questions you need. We won't let you do something we don't think you're a good candidate for. Our results are such that 98% of people are happy after we do the procedure. 2% may be a little bit disappointed. Maybe they expected that they would have better vision than they got for various reasons. We cannot make guarantees to anyone. The chances for troubles that are bad, like infections, less than 1 in thousands. So this is a very successful procedure that works nicely. I'm just going to touch on a couple names of some of the newer lenses that we're using. There's one called the PanOptix, which is a trifocal lens, gives distance, intermediate, and near vision. Another new one that's coming out now, we were investigators for, is called the Vivity. We also use the Symphony, and earlier models were the Restore and the Crystal Lens. So we're up on all this, and often we are investigators for the FDA. We appreciate that opportunity as well. So we're very committed to staying on the cutting edge and doing our best we can for you. We consider you all family.
And it's time for questions and answers.
Okay, thank you very much, doctors. And we do have a few questions. What precautions are in place for an eye exam and the cataract procedure? The doctor is very close to the patient during the eye exam face-to-face. How are exams done now to ensure patient safety and prevent spread of COVID? Great question.
I think we talked on that.
Yeah, I mean, we just touched on that. I think Dr. Reiser really, Harvey really expressed that. So we've gone to the length that every exam microscope in our offices have a plexiglass barrier between the patient and the doctor. Additionally, everyone is masked, both our staff and the patient. When you come to the door, your temperature will be checked. We will ask you questions. So we're really screening. We're following the CDC guidelines. Just so you're also aware, all of our employees each day when they show up at the office have a temperature check, have to sign off that their questions. If anyone has any type of thing, they are at, if any of our employees have any symptoms, we ask them to go home. And we have not had any problems. And just as that too with the patients, the same thing. If there's any patient that we identify that they might have a risk or they're having some problem, they are also sent home. The same thing happens at our surgery center. When you do have surgery, you'll actually pull up in your car, you'll go to check in, they'll actually call you in your car first, again, asking you the questions. You'll have to wear a mask in, your temperature will be checked. And so, we have and everyone is wearing the appropriate PPE or personal protection equipment to make sure that we have the most safe environment that we can provide.
Okay, great. There's another question. I have amblyopia. Can I get cataract surgery?
Absolutely. I mean, amblyopia means you have a lazy eye. So that means that eye, for whatever reason, whether it was turned out or turned in or had a high correction that was required that wasn't picked up right away, is not going to see as well no matter what we do. But if a cataract develops, it just drops off further. So by taking out the cataract, we'll get you back to your very best vision. It may not be 20/20, it might be 20/40 or whatever, but still, you wouldn't want to continue to have additional problems in that eye when you can see better than you are with the cataract. So yes, the answer is yes, you can.
Okay. Can a cross-axis astigmatism be corrected?
I think what they're trying to say is an oblique astigmatism. So typically when we talk about astigmatism, it's either at 90 degrees or 180, but astigmatism can really be anywhere around the dial if you think 360 degrees. So yes, a cross-axis astigmatism can be corrected.
And at what locations can surgery be performed?
Well, again, we do operate at different locations. When we do upgraded advanced cataract surgery, that is all done here at our 44th facility, right next to our office around the corner. We do have other places where we do operate, Hazleton and Scranton, mostly basic surgeries done there. And I would tell you our volume is much higher here. I think also, our facility, we have 3 dedicated rooms for cataract surgery. All the instruments are here, they are ours. At the other facilities we go to, while they're excellent facilities and they are good centers, we actually have to contract with a third-party company to help bring in the equipment for those days. So, a little different. We are very at our facility, and we're comfortable at the other facilities, but obviously we prefer our facility when possible.
Okay. How long does the laser surgery last?
This is a permanent solution. So unless something else comes up and gets in the way, for example, glaucoma, retinal detachment, this is a permanent solution to your vision. There's a little drift as we get a little older of some changes in astigmatism and correction, but The thing that's been changing that changes your glasses requirements is the lens in the eye, and that's coming out. That is the cataract that is being removed. So it's permanent.
Yeah, I think where that question might stem from is they've heard of people who have had laser vision correction, LASIK or PRK, in their 20s or 30s, and they had to have a touch up where their vision's now blurry again because they have a cataract. So cataract surgery, remember, we're replacing the lens in the eye with an artificial lens that does not, as Dr. Reiser said, drift. So cataract surgery has a very stable, very permanent visual outcome as long as the eye stays healthy and you don't develop other disease processes.
Okay. If your vision is extremely bad, is the surgery performed on both eyes at the same time?
Well, so in certain areas in the country, we do bilateral cataract surgery. I will say that is not a common event here where we are. Typically, what we will do is do one eye, and then a couple days later, maybe a week later, do the other eye. I think what the patient's saying is I have a very high prescription in both eyes, and if I have prescription done, then my one eye is corrected, and I may feel unbalanced. We can, if it is that bad, sometimes we'll have a temporary contact lens we can place in the non-operated eye. But typically in patients like that, we'll try and do them a week apart. But I will say more and more as we move forward with the new technology and we have better infection control, that bilateral cataract surgery is probably not far off in the near future here.
Okay. Can you do one eye for reading and the other eye for distance, or are lenses the same in both eyes?
Yeah, that's called monovision. And that's a good way to lessen glasses. It's a bit less expensive in terms of the options that we can give, because each eye is individualized, one to distance and one to near. I would say that most people that we do that on are people that have been trying that or wearing contact lenses and are used to that. If you're not used to that, it's very possible you won't like it. You may feel unbalanced. So the answer is yes, it's a good way to try and minimize glasses. You are splitting the eyes. So for example, if you're driving in a snowstorm and it's dusk, you may want to have a pair of glasses in the car that you can use to have the reading eye go up to the distance eye and be functional. So it is another way to achieve more, lesser degrees of glasses.
In the selection of lenses, which include Vivity, is the choice made by the doctor?
No, I think really there's a conversation as we go through your vision, what your desires are, what your needs are, and also not every lens is a perfect fit for every patient. Okay, so we have PanOptics, we have Vivity. And based on their abilities of those lenses, sometimes we feel that lens may fit one patient better than the other. But it is a discussion, and that's what we do during the consultation. Is not only, there's basically three parts to the exam. One is, do you have a cataract that is necessary or should be removed because it's interfering with your vision? Two is, do you have a healthy eye? And then three is, what type of vision? And based on the technology we have at the hand, how can we customize it to help you get to the goal that you would like?
Great.
The two distance and near lenses that we're talking about a lot are the PanOptics and the Vivity. The reason we are mentioning that, the PanOptics is the most common type of lens for distance, intermediate, and near vision. Its strength is good range at near. It achieves this by putting little rings in the lens that gives that near vision. At nighttime, you may have a little halo or glare around lights with that lens, but those rings that are around there for the near vision can't be removed for nighttime. So they're part of that lens. So its strength is great near. If someone's going to sit and read a book for hours and perhaps doesn't do a lot of night driving, that would be a great choice. The Vivity strength is very good distance vision, minimal nighttime disturbance. All humans, even without a cataract, do not see as well at night as they do during the day. We are daytime creatures. Colors come out in the day, etc. So nighttime is always tough. So this lens, the Vivity, maximizes night vision and distance vision and does that in a different way such that it doesn't have rings. So it can only give intermediate vision generally. We don't want to promise near vision as well. So if you do a lot of computer work, if you drive a lot at night, if you use your cell phone a lot, if you do crafts and you knit, if you do those kind of things, that's a great lens. If you don't mind putting on readers to read a book. So, and sometimes having done a number of Vivity, there are plenty of people that don't wear glasses at all. So I'm not trying to say, but we don't want to overpromise to you. We want to underpromise and overdeliver. And that's the discussion that we're going to have. So each person and what they want to get out of this gets the lens they want.
All right, and one last question. Will the surgery correct floaters?
No, floaters unfortunately are like luggage. Typically, once you get them, you have them for life. Now, we do have a great doctor here at our practice that does do surgery for them in certain cases, and we'd be glad to have you see him. But for the most part, the floater really has to do with the what we call jelly on the inside of the eye. So that floater is there. So sometimes when we actually do cataract surgery, for a couple days afterwards, you may actually notice your floater a little more prominent because more light's coming in and we've cleared up your vision. But typically, you know, they will go away or you just become used to them. But no, they do not go away with cataract surgery.
All right, thank you. And one last question, can copies of the presentation be emailed? And I'll take that one. Yes, we are going to email everybody a copy of this presentation. And feel free to add in the comment section any suggestions you have for us to improve our webinar series. We will be doing more of these. And also, please feel free to schedule an appointment with one of our doctors for an individual consultation if you've noticed changes in your vision or if you've been told you have cataracts. We would love for you to come in and see us, call the number that's listed on this screen, or again, type your name and a contact number in the chat box and we'll be happy to give you a call. Thank you so much, everyone, for coming. Thank you, Dr. Roth. Thank you, Dr. Reiser. And have a good night, everyone.
Have a good night.
Have a good night. Stay safe.
Yep.